sleep disorder breathing in children is enormous. And I see so many kids, and I have the conversation with parents all the time. Again, in the UK and with the NHS, and just generally amongst dental professionals, there's a bit of controversy and disagreement about what it leads to and what the evidence is to support it. But it's very common, and I see it clearly. And I've encouraged parents to take their child to the GP to have an ENT referral, because the first thing to do when you suspect that your child is having poor quality sleep is usually to see an ENT doctor. They have a look in the back of the nose. They look in the back of the throat. They check the tonsils. They check adenoids, these little immune cell growths in the nose, which can block the nose. And if a child is having regular tonsillitis, there's a good indication to do a tonsillectomy. Either they take out the tonsils completely, or they do a partial tonsillectomy where they shave down the tonsils so that they're not these giant golf balls in the back of the throat, causing the child to sleep poorly. So many parents come in and tell me that their child is snoring, a 4-year-old, a 3-year-old snoring, or grinding their teeth. It's incredibly common for children to grind their teeth, and they do that for the same reasons. They're not sleeping well. So they wake up, and I see kids coming in with worn down deciduous teeth. Their front teeth are really worn down, and it's commonly sleep disordered breathing. And for many people, having tonsils and adenoids removed can make a hugely profound impact to how the child sleeps. And pretty much overnight, I've heard parents say, as soon as the procedure was done, they healed. They slept through the night. They were better performing at school. And if the child is sleeping with their mouth open and snoring and having apnea, well, think about the facial growth and the development. The tongue is incredibly important. Ideally, when children or adults are asleep, the mouth should ideally be shut. We should really be nose breathing. The nose is super important to filter the air, to warm the air. But if someone's mouth breathing, mouth is open. Now, when the mouth is shut, where does your tongue live? Your tongue lives on the roof of your mouth. Tongue is this incredibly important and very strong muscle, which for children's facial growth can have a very important job of helping the jaw, the upper arch, grow nice and wide. That allows more space for the airway, for the oxygen, but it allows the teeth to come through straight. So another sign that we see is children who have poor quality sleep and which hasn't been managed, they usually are the ones who have a narrow jaw. The palate is super high up because the tongue has been not sitting at the top and making it nice and wide and shallow. The tongue is on the bottom of the mouth. Bottom of the mouth is open. Tongue's down there. It means that the way the palate develops, it doesn't develop wide and shallow. It develops really deep. And if the palate is deep, think about the airway. It's shared between the nose, the nasal airway, and the palate. If the palate's higher up, it means there's less space for the nasal airway, which means they're less likely to be able to nose breathe easily. Then that leads to it's a vicious cycle. High palate, more difficult to breathe through the nose, more likely to breathe through the mouth, more likely to snore, etc. More likely to have a narrower jaw, which means that the adult teeth don't have enough room to come through where they should. So these are the children who need orthodontics, who need teeth taken out to straighten them up. So it's all related.